Hello, my name is Brandy Broadwell. Today I'm going to talk to you about my research topic, which was chronic restrictive lung disease. In this presentation, I'm going to talk to you about the two main types of restrictive lung disease, the etiology of the disease, some predisposing factors, symptoms, and treatment of the disease. So, chronic restrictive lung disease is a disease where patients have some difficulty breathing that can be severe due to not being able to completely fill their lungs with air. So, patients are restricted from getting a full lung expansion. So, this restrictiveness can be a result of a condition causing stiffness in the lungs themselves, or it can be due to stiffness of the chest wall, weak muscles, or even damaged nerves. So next I'm just going to show you a few pictures of some different lungs. This one, this is just a picture of small and firm lungs that's due to restrictive lung disease from advanced pulmonary fibrosis. You can just see how the lungs get smaller as it worsens. Okay, this is lungs from a patient with end-stage sarcoidosis. You can just see like in here, all of that right there. Okay, this is an x-ray of a likely case of idiopathic pulmonary fibrosis, and you can see the difference in this right here compared to this side over here. Now this is just typically treated with medication called prednisone. Okay, so chronic restrictive lung disease can be classified as either intrinsic or extrinsic. Intrinsic restrictive lung disorders, they're due to the problem arising in the lungs themselves. So this can be different things such as interstitial lung disease, idiopathic pulmonary fibrosis, just pulmonary fibrosis, and sarcoidosis. Extrinsic restrictive lung disease, they're due to disorders that arise outside of the lungs. This can be obesity, pleural effusion, scoliosis, and neuromuscular disease. So, etiology. Restrictive lung diseases are a heterogeneous group of conditions characterized by a restrictive pattern on spirometry and confirmed by a reduction in total lung volume. So all chronic restrictive lung diseases is patients not being able to fill their lungs with as much air as typical due to some kind of restrictiveness in the lungs. So next we have predisposing factors. A few of these could be age, sex, race, lower education, former and current smoking, doctor-diagnosed cardiovascular disease and diabetes, and abdominal obesity. Some symptoms of chronic restrictive lung disease: dyspnea, fatigue, impairment in muscle force, exercise tolerance and activity to daily life, coughing, depression, and anxiety. Coughing is often dry, but it can be seen with a right sputum, but most of the time it's dry. Depression and anxiety, this can just be from your patient once been able to be independent and do stuff on their own and go out and do stuff that they once enjoyed that they no longer can't due to the intensity of their shortness of breath and fatigue. Some used to do everything on their own, and now they're having to have people help them walk because they just can't breathe enough to do it on their own. Treatment, so a few different treatment options. You can do medication, cellular therapy, oxygen therapy, exercise, or transplant. I'm going to break each one of these down and talk about them individually. So first we have medication. There's a few medications that you can take that'll help alleviate symptoms of most causes of restrictive lung disease. Some examples include Esbriet, Ove, corticosteroids, azathioprine, cyclophosphamide, and methotrexate. There's an article by H.C. Robinson that tells us of some newer drugs that's been used to treat individuals with idiopathic pulmonary fibrosis, and that's the top 2 drugs on this list. Those are being used to slow the disease progression. And then the bottom 4 medications on this list are used mainly for like the inflammation that can arise. Cellular therapy. Cellular therapy is a procedure in which cellular material is being injected into the patient, such as intact living cells. This can only be done with certain diagnosis of restrictive lung disease. Lung Institute states that cellular therapy works to promote healing from within the lungs, potentially improving lung function and quality of life. Oxygen therapy. Oxygen therapy is used to help maintain the blood oxygen levels. Many patients who can do cellular therapy, it's been shown that they're decreasing their amount of oxygen therapy under the supervision of their MD because the effects and benefits of the cellular therapy is being seen to be greater than that of the oxygen therapy. So you're seeing a decrease in oxygen therapy in some patients due to the benefits of the cellular therapy being better. Most importantly, exercise. Exercise can greatly help decrease dyspnea sensation, and it's been shown that dyspnea is greater affected if the patient participates in a longer exercise program. There have been studies done that put patients in like a 6-month program and versus like a 9-week program. And it's been shown that the ones who are doing the 6-month program have a much better outcome due to the prolonged time of exercise. So that has been seen often. If the patient's condition is so severe that they're not able to participate in normal exercise, they're trying exercise training with negative pressure ventilation a lot now. Due to exercise just been so important that some patients can't breathe enough to participate in any kind of exercise at all. But with the negative pressure ventilation, they're being able to get some kind of exercise, which is better than none. I read an article and it stated that exercise training with negative pressure ventilation support is feasible for patients with severe restrictive lung diseases and improve exercise capacity and health-related quality of life. So exercise is super important, and even if you can't do it like you normally can, they're trying different ways now to get patients any kind of exercise possible. Okay, transplant. WebMD states that severe end-stage restrictive lung disease, such as idiopathic pulmonary fibrosis, may be treated with lung transplantation. So this is just for the severe end stage. Most oftentimes it can be treated otherwise, but for the people with this severe end stage restrictive lung disease, they're going to need a transplant. Prognosis. Prognosis of this depends on the cause of the disease, like many other diseases. There's so many different reasons a person can get restrictive lung disease that there's not one specific outcome of the disease. Article on Webscape states the mortality and morbidity from various causes of restrictive lung disease is dependent on the underlying cause of the disease process. Most oftentimes restrictive lung disease can be treated and the outcome is in good standing, but patients with idiopathic pulmonary fibrosis have a mean survival rate of less than 3 years, and that's if they don't get the transplant. If they get the transplant, their survival rate is much, much higher. Okay, so this is just a list of all of my references. And that is it for my video. So if you have any questions, please feel free to reach out to me with them, and I will try my best to answer them for you. Thanks.